questions you may have.
Thank you, Mr. Chairman. Welcome, Director Vought. Branding is very important in the characterization of the reconciliation bill, and there are many who are calling it one thing, but there are many others who are characterizing it as the big, ugly bill. I want to talk to you about your proposals relating to USDA research. You eliminate the Hatch Act formula grants, which go to the 1862 land-grant institutions. There's a 44% cut to Evans Allen research grants for the 1890 land-grant institutions and a 14% cut to the 1890 extension services. The Smith-Lever Cooperative Extension Program is cut by 46%. Ag research has been the tool that has kept America ahead of our international competitors for decades and is right now more important than it ever was in our competition with our international competitors. We're falling behind other nations on ag research, so I strongly believe that research should be the last place that we should be looking at cutting. How do you justify these cuts other than as part of your overall budget numbers quest if America is going to continue to be able to produce the highest quality, the safest, the most abundant, the most economic food and fiber anywhere in the world?
Thank you, Congressman, for the question. I mean, we believe in agricultural research, and I think we believe in the research that even in areas where we're taking cuts, our desire is to make sure that we actually do research, that it's not going to some of the projects and line items that you saw Secretary Rollins put out there that she has canceled. And so where we found efficiencies, and we wanted to make those reflected in the fiscal year 26 budget. But agriculture is incredibly important. We have to be able to feed ourselves first and foremost, and one of the ways that we need to be able to do that is not just our farm support programs, but the extent to which we're thinking ahead and planning for the future and learning.
Thank you.
But there is,
Thank you.
I think in the eye of the beholder, there might be some differences.
Thank you. Currently, my state, Georgia, is the most recent state to implement the Medicaid work reporting requirement. So far, what we've seen is a cautionary tale for other states. Higher administrative costs, increased bureaucratic red tape, and suppressed enrollment, even among eligible Georgians. In my congressional district, there are over 765,000 Georgians, and almost 17% of them, of the non-elderly residents, are uninsured. However, after 18 months of implementation, less than 1% of our district's residents who are aged 19 to 64 were enrolled in the Georgia version of Georgia's Pathways to Coverage program. That's in spite of the state having spent $92 million in combined state and federal funds on the program, most of which covered administrative expenses like technology upgrades rather than actual health care benefits. In other words, taxpayers are funding for-profit consultants to add on to clunky, outdated systems to process paperwork rather than covering the cost of doctor visits and prescription refills for eligible Georgians. If the budget reconciliation bill mandates work or other community engagement reporting requirements for low-income, able-bodied adults across all states, how can we avoid the high-cost, low-coverage pitfalls evidenced by Georgia's Pathways to Coverage program? For example, how will the federal government ensure that taxpayer dollars are going to health care benefits rather than more bureaucratic red tape, as we've seen in Georgia? And quickly, the second question is, most of the $92 million that was spent has been covered by the federal government, due in part to the higher federal match for administrative expenses like technology upgrades. This expense would not be necessary if not for the additional paperwork generated by the work reporting requirement. For 1,115 demonstration programs like the Georgia program, what steps have been taken to ensure that states are held accountable to rules regarding budget neutrality if they implement this on the nationwide basis?
Well, thank you for the question. I haven't looked at Georgia's model, and I will look into that. Our belief is that this will not lead to additional paperwork, but that it will build on the historic reforms that we saw in 1997 that were on a bipartisan
There have been
basis.
studies done on it that have been published that have made it very clear. And of course, obviously, the people who are skeptical of that have made that clear also. It's out there. And I'm surprised that you haven't been.
Well,
made
I mean,
aware
as
of
it pertains to the 1997 reforms, which now applies the concept of work to Medicaid. And remember, in Medicaid, we have this issue where you have able-bodied working adults that get a higher match than the originally intended beneficiaries, the disabled, the elderly, who, you get $9 for $9 federal dollars for every $1 of state for the able-bodied working adults, and then you
that's
get
correct.
about 1.30 for every one at the lower populations. And that's something that's off, because what you have is states chasing the higher dollar. So with this work requirement, we'll make sure that we have
It means that more
important
money will have
reform.
to go for the states setting up the mechanism in order to calculate that. It's more red tape, more paperwork, less than services and care for the people who need it.
We can
Thank you.
disagree on
And
that.
the chair will now recognize Mr. Cloud.